Morning, Dr. Karthik.
Morning, namaste.
Namaste. You are sporting a brand new look.
Namaste. It's a kind of a COVID look. You might have heard India is in lockdown and our saloons and barber shops are not open. It's like sustainable style.
I love it.
Thank you.
If for those of you who are just joining, we have a few minutes. So if you'd like to switch on your video and say hello to everybody, that'll be great.
Hello, Dr. Karthik. This is Om.
Hello, namaste.
Finally seeing you in face-to-face after a long time.
Long time, I know. Thank you.
Yes. How's your independent practice or venture going on so far?
It's great. Thank you for asking. It's going very great and literally out of time, doing a lot of things at the same time.
Of course.
So going great. Thank you for asking. Thank you.
Very nice. Very nice.
Anyone else would like to say hello?
Namaste, Dr. Karthik. Sudha here.
Namaste, Sudha. Hello. Hi.
Hello. Yeah, I really enjoyed many of the sessions you had, with the Kerala Ayurveda AWC program. Now I'm in AWP, but thank you for sharing your knowledge.
Oh, thank you very much. Very nice to hear that. Thank you. Hello, Michelle. Am I saying it right? It's Michelle.
Yes, hi, welcome. We miss you. We loved your classes, but we wish you well in all your ventures. So thanks for being here today.
Thank you very much. Thank you.
All right. I think it's a little bit past 9 a.m. and we have a lot of interesting things to talk about. So would love to get started. So if everybody could maybe switch off their mic, switch off their video so that we can focus the conversation on Dr. Karthik, that would be great. So I think everybody's, yeah, looks good. All right. Namaste, everyone. Happy Friday. Thank you for being here today for our next episode of In Conversation with the Vaidya. We're so lucky today to have Dr. Karthik join us. Thank you, Dr. Karthik, for being here today and sharing your time and knowledge with all of us. For those of you that this is the first time that you're joining us for In Conversation with the Vaidya, this is a very casual conversation that we have to learn more about the experiences, day-to-day experiences of Vaidyas. And it's a Q&A. And typically, I ask a few questions and then we invite participants to drop in their questions via chat or if they want to speak up and ask their questions. But we'll have specific breaks in the flow to take questions. So we'll definitely do that, but feel free to drop in your comments and questions in the chat as we go along. So let's get started. So Dr. Karthik, thank you again for being here. And maybe we can just start by talking about, your practice. So tell us a little bit about your practice. Where are you based? How you're practicing right now? If you have any, specialties or areas of expertise, we'd love to hear about that.
So thank you, Shruti, and all of you for having me here today. So right now, I'm at Kerala right now. So in my hometown, at my ancestral home, I am based out of Bangalore in Karnataka for the last few years, but I frequent between Trivandrum, which is my hometown, and Bangalore, which is my current home. This is my ancestral home. This is where I was born and I was brought up. I have a practice here where I look after people from around my village. So that's kind of a very traditional practice that we have here. But most of my practice happens across online on Zoom. Luckily, I have yogis from across the globe, which I consider as a huge blessing, being able to work with a lot of people around the world. From US, from Europe, and also from Japan. I have been practicing with Japan clients for a while, so I have a lot of people from Japan who have been working with me. They have a very great culture, very gentle and soft kind of people. So I love working with them. My practice essentially evolves around, I would say, education, and that would actually concise everything for me. The way I want to do practice, which often my guru has told me, is that your yogis shouldn't come to you like more than once or twice, because you should be able to educate them on how to live healthy, and you should be able to help them recover and lead them through a life where they can go on and take care of their own health. So essentially empower them is the idea. That is the principle that, or the benchmark I have kept for myself. I can't say that I'm quite successful in it, but I definitely try to reach there. I hope I will one day, but
That's wonderful.
that's what I've been trying to do. My specialties, I've been specializing all of my life. I look at, I studied Ayurveda when I started studying Ayurveda when I was around 13 or so with my gurus. And then I went into quite a traditional setup of treating from a hospital. I was a head of a hospital. I was head of a medical service. And most of my career, I have been treating people inpatient. That is where I admit people in their hospital facility and treat them. Basically through Panchakarma, chronic illnesses, complex cases. That has been my specialty for all of my career. But right now, I'm more focusing also on entry-level cases, if I said so, that it's a doctor's lingo. But again, that is something which I'm doing right now, which I enjoy quite a bit. If you look at a pathology-based specialization, I think if I look at the cases that I have been treating for a while, I have been concentrating more on joint disorders and stroke and basically cardiovascular accidents. And from there to diabetes, I became quite interested in diabetes in the later phase of my career. But right now, most of my practice is around COVID patients. So I treat a lot of COVID patients, moderate cases. As you know, India is going through the second wave of COVID.
Yes.
So I treat a lot of COVID patients.
Right.
Today, that makes most of my practice.
Right. Very interesting. And as you mentioned that, you were at a very young age, you got to head up a hospital, and a lot of your practice is, looking at inpatient cases. So it's very, and you've also taught in, Western countries, you're continuing to teach. So how do you kind of see the difference between, the way that we are practicing in US versus India? Because obviously, the inpatient model is not there as much. So, and especially because, we have a lot of practitioners here today in the call. So how would you what would be your advice to them to figure out, like, in, what cases should they explore, maybe having yogis go to India where they can get inpatient care versus, continuing to treat them in an outpatient model here?
So Shruti, in 90% of the cases that I feel, and I would say this, that at least 90% of the cases which comes to an Ayurvedic practitioner doesn't require an inpatient management, and most often they don't even require a Panchakarma. I would go on and I would say this in record that today one of the most abused areas of Ayurveda is unnecessary application of Panchakarma. In most of the cases, the right kind of shamana will do the healing, but Panchakarma has become a buzzword. And most of the people who learn about Ayurveda, who wants to experience Ayurveda, actually go for Panchakarma. So I have had this experience while I was practicing as well. Like somebody who is coming from a Western world would come to me and would say, "Hi, doctor, I would like to experience Panchakarma." I would often ask them, would you do the same with a cardiac surgeon? Would you go to a cardiac surgeon and say, "Hi, I would like to have a cardiac bypass for an experience"? You don't do that, right? Panchakarma is as serious as, I would say, as an important procedure as a cardiac bypass. Because if you don't do it right, and if you do it for the wrong reasons, it can do more harm than good. I'm not saying Panchakarma is not good. I'm saying the way you administer it and the reason for which you are doing it has to be very credible, has to be very solid. If you don't do that, there is actually a lot of harm that it can bring. So having said that, I would say the right kind of shamana, the practice which is existing right now in US, is good enough, it's strong enough to actually take care of a lot of pathology out there. You would need Panchakarma, definitely. You would need very serious interventions when the disease is so chronic, when the symptoms are quite strong, and it has to be dealt with Panchakarma. One difference which I see across India and US in terms of practice is one, that in US, since Ayurveda is hugely unregulated, it is presented as a wellness therapy. And the way with which the Ayurveda practitioners who have learned Ayurveda in US are dealing with their yogis is more in a wellness perspective. And while that is great, and while that is the way to go, one feedback that I have is what that makes difficult is the process of diagnosis. At the end of the day, Ayurveda is a healing science. So it has to follow a certain amount of protocols which actually help them to arrive at a diagnosis, to create a treatment protocol, and to choose the right kind of herbs, right? The whole process gets much more easier if you actually view Ayurveda from a standpoint of a healing science. And if your way of case taking, if your way of dealing with yogis, while remains holistic, if it is more inquisitive, it's more engaging on the level of a clinical medicine, would make much better application. That's my feel, having been taught in US and in India, and been working with practitioners across these two places.
Right. How do you see the difference between engaging with yogis in, sort of this, I guess, more of a US model versus India model, where the India model is a lot more, like, it's like a standard hospital, right? You're seeing somebody for 5 minutes, 10 minutes, and, you're prescribing them a bunch of medication, whether it's, Ayurvedic, it still, qualifies as medication in India. But in US, it's much more around, lifestyle practices, educating them, diet, all of these different pieces, right? So what in your model is more effective?
It's not just about having a model being better. It's about, I think, the way with which you practice and the way we had to practice. During my internship years, so I did my internship with Central Institute of Panchakarma in Kerala, and I actually met one of my guru there. His name is Dr. Vd Krishnan. So Vd Krishnan he's a prolific clinician. So the way he practices is like he used to have at least 200 yogis in a day in an OP, which is ranging starting from morning 8 o'clock to maybe afternoon 3 o'clock. So we'll be like, we were his assistants. So if you have to look at 200 patients through one day, right? How much time you can spend? You can hardly spend 5 minutes with each of them. So we are forced to create a competence which will actually make you understand the illness, reach a diagnosis, choose the right kind of herbs in these 5 minutes. So we develop that kind of a temperament, that kind of a competence, which is required. I would actually like the US model where you can have more time to work with the yogi. If you look at, I would personally love the US model in which we have much more time with the yogis. The great thing about the Indian model, or the Vd Krishnan model, I would say, is that the way in which the art of case taking has evolved. The moment you write the presenting complaints, the moment you start interrogating with the presenting complaints, you're already making a diagnosis that increases how do you put the interaction as well. For example, when I write a presenting complaint about, let's say, knee joint pain, right? I already have my questions backed up in my head, lined up, asking, so that my entire aim is to determine whether this is a Vata Rekta, whether this is a Sandhigata Vata, or this is an Ama Vata. Okay, that is my sole aim, because I know these are the only 3 pathologies possible. Then the only work as a clinician that I have is to differentiate which is which, and then go to a treatment protocol from there. So I already have a lot of questions lined up in my back, or my tools ready in my hand, which would help me do that. The trouble with this is the patient doesn't get a lot of personal attention to go with this, because when we are focused in this much in a clinical aspect of it. So the good thing for the US is that we get a lot of time to interact with the yogis, talk to them about the lifestyle, the food habits, and so on and so on. I would say a bad thing about it is, if there is a bad thing at all, if I could say so, is that we often get lost in the details. For if you look at a US case sheet, which I've often seen, is it goes on and goes on with a huge number of complaints, shortnesses, dhadus, and everything. you lose track of what you're looking for, right?
Right.
So
right.
it's like what Sherlock Holmes said to Watson. You need to know what you're looking for, right? Only then you'll see it. So a
Right.
clinician, as I'm being taught, is kind of a Sherlock Holmes. He's trying to deduce facts from a certain set of evidences, and
Right.
that is the way to go. So you need to know what you're looking for. You need to understand what you're looking at. I think if you know that, it doesn't matter whether you follow an Indian model or a US model, you should be a successful clinician.
That's a really good point. I mean, at the end of the day, there are practitioners operating in India and there are practitioners operating in US, and you have to operate within those, confines of where you are. So really making the best of that makes a lot of sense. Another thing that you mentioned is that you got interested in diabetes later on in your career. So how did that happen?
Okay, it's not actually a happy story though. My father had diabetes, and he actually expired because of diabetes. So that actually it was kind of personal for me. That actually kind of led me into saying diabetes more seriously. Then I happened to become the head of that diabetes division of the hospital that I was heading at that time. Now, this was a place where very excellent doctors used to practice. Doctors like Agnivesh, doctors like P. Rajagopal, and like he was a Padma Shri Awadi. So, great people, giants of Ayurveda. So when I became the head of this clinic, and I used to have like 5 doctors who were working with me on the same clinic. And the thing which we noticed was that even though we are quite successful in actually resolving the diabetic issues, most of the patients that we have treated or treated by my predecessors often come back after 6 months or a year or 2 years, right? We were actually not doing anything impactful. The disease still exists. We are trying to control it for some time. As long as the rogi takes care of the food and the medicine, the disease will be at the bay, then it will again come back. So I wanted to actually try and see if we can actually do something about it. And also from the personal tragedy that I've gone through, and from this interest. So what we did is we started studying more into diabetes, and we started inquiring more about what the modern medicine has been doing, or what the modern research tells us. We were quite happy to understand that the modern research are actually going more towards the fat metabolism, rather than just taking care of the glucose in the blood sugar, right? Because Ayurveda actually says prameha is a medo dosha, right? It's a disorder related with the medo dhatu and the uddagavaha srotas. So that got us interested, and we went that way. We ended up at the research of Dr. Roy Taylor from UK, who actually claimed that diabetes could be reversed. So based on his ideology and based on our findings from the Ayurveda textbooks, especially Ashtanga Hridayam and Charaka Samhita, we formulated a unique protocol which we thought could reverse diabetes. And we did our initial studies, and they are quite interesting. I would say out of 10 people who did that study, six of them actually reversed their diabetes. When I say reverse, that means they got out of all the medications, including Ayurveda. They were able to live a normal life with a sensible diet control and exercise, and was completely out of medication, was completely out of diabetes. So that led us to a bigger study with another 60 people, and that was also quite interesting. The results were similar, and which led to further 2 more studies, which also had the same results. Right now, even though I'm still out of Kerala Ayurveda, I'm doing a research with them, along with the Government of India at Shetty's Hospital in Bangalore, which is a clinical trial registry of India registered study, where we are trying this protocol in people to reverse diabetes. So that's how the diabetes came around.
Got it. And if I am not mistaken, weren't you also involved with the atta, like the wheat flour product that Kerala Ayurveda also, and that's also addressing some of the same diet issues, right?
Yeah, so that atta, which is a proprietary atta, I was involved in the research of that, and that is a part of our treatment protocol. So that is used to create certain diet in diabetes. Yes.
Right. Wonderful. And so I guess, I mean, yes, in this case, like, I guess it came from a personal experience, but I do see actually a lot of that, as practitioners or as Vaidyas, people really take some of their personal experiences. They may have been difficult or adverse experiences, but that really like almost establishes within them, and a need to explore that or investigate that more and learn about it and then help other people. So did you kind of experience that as well?
Um, I would say kind of quite a controversial question in that. If you look at the modern medicine as we call it, and if you look at medical ethics, you are often taught that never to mix your emotion with healing, right? And never to treat your, your relatives, your father or mother as such, because the emotions that you have might make you misjudge things and lead you to wrong treatment. But if you look at Ayurveda, we have a quite different philosophy. Ayurveda says even Pipilika, Krimi, Kidam, everything is your family. All the insects of the world, everything that is around you is your world. And I quote from Ashtanga Hridayam, if you look at Uttarasthanam, chapter number, I think 30, Uttarasthanam, the last chapter, Vachikarana Vidhi, it ends with saying, try to treat all your yogis as your own family. Okay, as if you treat your own daughter or your son. You should do that. So that's what Ayurveda says. It has a very different philosophy altogether than the modern medicine. I used to feel very bad when I was not able to treat well, right? When I started practice, when I was in my younger years, I used to feel very bad, emotionally drained out when I'm not able to heal people. Now, it is impossible to heal everybody, okay? We know that. So if you look at Ayurveda, Vakpida himself has said certain diseases are asadhya, certain conditions are asadhya. If the dosha, the ritu, and the food and the diet and the prakriti of the person has the same dosha visheshan, you cannot treat them, you cannot make them better. But even then, we'll feel bad because somebody comes to you to help and to heal, and they have great expectations. And if you're not able to deliver, you'll definitely feel bad. So I felt this was quite a challenge for me because I get emotionally involved. And I went to my guru, who is Dr. Vd Karthik Krishnan. At that time, he was 65 years old, and he was treating from his age of 20. So 40 years of experience, right? And I went to him and I said to him, I don't think I make a good healer. I have this problem that I still feel bad about being not able to deliver or not able to heal people. I don't think that's a great trait. So this man, who has been doing healing his entire life, who is seeing 200 patients every day, said to me, Karthik, I think you're far better because I still cry at the bathroom after I do consultations because he's not able to heal people. So he said, you don't have to feel bad about it because that is what makes somebody a good healer. Because if you feel like you are not able to deliver, then you will study more. You will dig deeper and try to understand what is wrong here. Is there anything wrong with the diagnosis that we have made? Is there anything wrong with the prescription that we have made? The lifestyle changes, dosage, or the whole protocol? Okay. Or we will go into textbook and see what we can do better and better. So that actually have helped me, I would say, to do better. I have had instances where I have prescribed things which I was not satisfactory. I have gone back to the textbooks again. I've seen something wonderful. I've come back and applied and made treatment much more easier, much more effective. So I would say, as far as I'm concerned, and I cannot speak for anybody else, but as far as I'm concerned, an emotional attachment with healing has helped me. Though it has its pros and cons, definitely its cons for sure. And even if you write a good laxation, right, it's difficult for you to sleep at night. You'll think about your rogi. Okay, what's he going to do? He's going to make the dosage wrong. He's going to have a shock. What do I do when I have a shock? So even though you work professionally, you do all these things, it actually makes you, I think, a bit more competent, a bit more sharp.
Interesting. Actually, on this note of, asking the patients to relax while you yourself are not able to sleep at night thinking about the rogi, what are some practices that you follow in your own life to keep you balanced, to keep you grounded?
So I have this, I would say my kind of lifestyle, I would even consider myself as erratic. But one thing which I strictly follows every day without any fail, I would say two things, is that one is I do my meditation every day evening. If there is any day where in US or in India or in Europe, every day evening, I make sure that after I pray and I do a 5 minutes of meditation. That is something which I do every day. And that makes me ground myself and help me to think much more clearer once I've done it. The second thing is Ashtanga Hridayam. Okay, so Ashtanga Hridayam to me is I'm not exaggerating. I should say this. It's kind of a religion to me. I have Ashtanga Hridayam everywhere. For example, I keep one in my table. Okay, I keep one in my car because if I get stuck area, I can read it. I keep one in my office, and I keep one in my Bangalore home, one in my Kerala home. So I end up with Ashtanga Hridayam at least once a day, and I read some sloka from Ashtanga Hridayam. So it is a way I think I connect with Ayurveda, and something about that book makes me more confident. Because think of it, at 7th century AD, Vakpada has written about all these illnesses, and he has said himself that, hey, I don't know the whole of illnesses myself. Vikaro, anama kushalo, najihriya katajana. That's what Vakpada said. If you're unable to get into a diagnosis name, don't be hard on yourself. Okay, he himself doesn't know because it's impossible to name all the diseases. Right. So he has been so humble, right? And then why can't I be? So Ashtanga Hridayam to me is a book which is quite favorite to me, and I think these two things actually keeps me quite grounded. And I think, yeah, that's it.
Got it. Very nice. So we'll take let's take some questions from the folks who are here. If they want to speak up or want to, post some questions in the chat, Michelle will help us moderate the questions a little bit. So please.
We have a question from Om.
Sure.
Go ahead, Om.
Okay. Thank you, Dr. Karthik. One of the main reasons of my joining this call was to learn about more diabetes. In the past, I have heard your presentation, and since that, certain things have been stuck in my mind, and I've been adopting that into my little knowledge of AWC practice I'm doing. Two questions. So one is your comment about the emotional attachment with the patient and the treatment or healing. This is nothing new. I have gone through this for many, many months. And I asked a question to my primary care physician. How do you control your emotion? Nobody comes to you with happy news. You go from one room to another room every 15 minutes. And every patient will tell their story, either cry or whatever the case. So how do you handle that non-attachment? I didn't get the answer from them, but I'm still trying to find the answer. And you gave that answer and you're very absolutely right. If you're not attached, if you're not connected with the rogi, you cannot heal them. This is my experience, very rightly said. The next question is about the diabetes. So diabetes, I would say that it has become a pandemic, especially in India. India is the #2 in the world for diabetes. Initially, I used to think that it is because a lot of carbohydrates issues, but now I think that movement is not there. People are going for westernization, and everybody has to work in the family to make the ends meet. What do you think? Knowing Ayurveda, knowing the diet, knowing the lifestyle in India itself, and I can understand in the US, you're taking the fast food. Many people have told me, is McDonald's not healthy food? This was the question. So I said, why do you eat McDonald's? He says, it is healthy. I thought it has all the taste. It has everything combined together. So that's another question. So what are we doing in India? Of course, US is a different story because everybody is focused on the medications. Once the endocrinologists know that your number is 6.2, he says, no change, nothing. We are very happy. But as an Ayurvedic practitioner or counselor, I'm not very happy to look at the number of 5.9 or 6.5. I'm okay with 7.0 HbA1c. But what happens daily, up and down of the daily blood sugar level, which causes your mental disturbance every morning, every evening. I've seen those patients, right? So my question to you is, if you can enlighten us with the diabetes, what are we doing in India? What are we doing for educating them? So we can adopt some of the models here to heal them. Okay. Thank you.
So I will touch both of your comments, what you said. So I already talked about the emotional part. While healing is, as I said, is to have an emotional connect with the rogi, it is also a problem, right? It is also a puzzle which is presented to you. So I see healing also as a puzzle. While the rogi is a human and they need help, they need counseling, the problem in front of you, the dosha, dusha, visheshana, has lot of factors in it, which are the doshas, the dhadus involved, and where is it taking place and what is happening. To me, it's kind of a puzzle, because the treatment, as you look at, as Ayurveda says, is samprapti vikatanam, breaking up the samprapti. So you need to have an idea of what samprapti is going on in the rogi to break it. So at the same time, while this is emotional in a different dimension, on another dimension, it is kind of a puzzle solving for me as well. So that's how it works on different dimensions. Now, as well as diabetes goes, why India has more incidence of diabetes has also a historical, political, social reason as well. If you come to Kerala, Kerala is also one of the places in India where we call the diabetic capital even of India, because a lot of people has diabetes. If you look at even my family, my father had diabetes, his father had diabetes, all my uncles have diabetes. So I expect to have diabetes myself. So the thing is, even if you look at the geography of the Kerala, even if you go 1 mile to the left or right of my home, you have to go for at least a few grades up and few grades down if you have to travel, if you have to go by foot, right? The terrain is so up and down that you need more energy to actually even tread at just a single mile. So if you look at the nature of the foods that we were eating from the past, we need a lot of carbohydrates. So we were consuming rice, we were consuming tapioca, we were consuming a lot of meat, right? Because we need energy. We need much more energy than a usual person who is in, for example, I was amazed to see when I was first in the US, I was amazed to see the expanse of land, which is quite plain, right? There is no upgrade or a downgrade, it's just plain land. If you come to India, you'll see that most of the places are like the terrain is quite up and down. So in all the times, we used to need a lot of energy to survive, to do our work, to do agriculture. So our food habits from at least from 10th century, the food habit has almost unchanged. There will be a rice, which is a carbohydrate portion, and there will be some wheat, which is a protein portion. There will be some vegetables, which also forms the fat basis or other carbohydrates, right? Or the fiber basis. Now, contrary to most of the people think, most of the people in India do consume non-vegetarian food as well. So there are a lot of proteins and also carbohydrates. So when the situations changed in India by, say, 18th century, when we have been moving more into white-collar jobs and stuff, though our life situation has changed and the lifestyle has changed, the food has not changed. Even today, I had rice and some vegetables for my lunch. So we are continuing to have the same diet pattern, and this is contributing to excess energy, excess carbohydrate deposits in your body, and that will essentially contribute towards diabetes. That is one. The second thing is the erratic lifestyle itself. For example, I eat my breakfast at 8 o'clock. Once I eat that breakfast, I get hungry, let's say by 12 o'clock. But most of the days, I cannot eat my lunch at 12 o'clock because I will be consulting or I'll be in a meeting. So I will just push that lunch to a more and more later time. So what happens is that your body will try and understand that, hey, this person is not going to eat at time. I might need to use my reserves, and it converts the carbohydrates and the fats in our body to create new sugar molecules. So this is what we call as gluconeogenesis. This is happening in your liver. So once this happens, though it's actually good for your body, the problem is the body will try and understand this as a trend, and a gluconeogenesis will become a part of your systems. So even though you are eating right, your body in the future will try to create more and more sugar molecules in your blood, resulting in an elevated blood sugar level all the time. The third thing you need to understand is that it's about the flight or the fight response, right? We all have that. For example, when we were primitive, when we were living in the forest, the problem that we used to face was if there was a crisis. For example, a tiger coming into your path is a crisis. Either you need to run from the tiger or you need to beat the tiger, right? You need to fight with the tiger and kill the tiger, maybe. So for both these phenomena, to run or to fight, you need more energy, more glucose. So the brain will release more adrenaline, which will make you more active because of the sugar surge in the blood, and you can either run or you can fight. But today, we still do have this response in our body because we have new and new tigers in the modern life. It could be an office deadline, it could be your partner, it could be your kids. All these kind of crises actually on a day-to-day basis release adrenaline and induces a sugar surge in the blood. Now this will essentially again create a hyper glucose situation in your blood and essentially result in diabetes. So there are many ways in which this happens. Right now, the modern theory being the excess amount of fat in the blood can actually create insulin resistance as well. So combine this, diabetes is a combination of all of this. If you're not addressing all of this in a holistic way, the chances of getting diabetic reversal is very less. So diet plus mental mindset, your habits, your lifestyle, plus medication is what works, or at least it has worked for us. So the protocol has all of these elements. And if you are able to tackle all of this together, I think it will work.
Thank you so much, Dr. Karthik. I feel like we definitely need a separate session to talk about diabetes alone. And each of the diseases probably deserve their own sessions for this. But thank you so much. That was a very precise and crisp explanation. So thank you for sharing that. Just moving on, I guess, since I do still want to ask you some more questions. So now that you're, kind of starting this, I mean, you have already started this new chapter. You were earlier associated with Kerala Ayurveda, you were teaching, you were part of the management there, you were heading up the Ayurvedic hospital there. And now it's almost like taking a new chapter for you. So tell us a little bit about how this shift happened and what are some things that you're enjoying or struggling with as you're making this change?
Okay, sure. So I have been actually wanting to take some time off and invest more into learning, because I've been feeling this for last at least for last 3 or 5 years, that I've been not learning enough, right? I was heavily invested into studying Ayurveda in my younger years. I used to travel a lot, study with many gurus, read more of Ashtanga Hridayam, and I was kind of missing all of those things. So I was trying to take a break and do this more and more. I have a lot of, since I get into something which is quite corporate as Kerala Ayurveda, I enjoyed the time there. It's just great working with it, but it kind of consumed most of my time, and I missed out a lot of things which I wanted to do. For example, there are a lot of knowledge which are still in traditional healers, which we are yet to tap. One example is, one of those days while I was working, one of my guru called and he said, "Hey, I want you to go to this old place, which is a home in a district called Palakkad in Kerala." And he said, "I want you to go there and I want you to find a house, because I have treated a patient in that house very long ago, like many years ago. And I gave them 2 bottles of medicine for an emergency use, right? They might still have it. Can you go and fetch it for me?" That was, he asked. So I traveled from Bangalore to Palakkad. I found this house, I went there, and they have actually kept those medicines there. And it was quite interesting because the name of that medicine is something which I've never heard of in my studies or in any textbook. It was called Shavam Nadatti Mukkute. Okay, it's in Malayalam, Shavam Nadatti Mukkute. So I'll break it up for you. Mukkute means a combination of 3 oils. Okay, it's usually castor oil, sesame oil, and coconut oil. Okay, so it's the base. For example, when we make any thailam, for example, cotton chukadi or muruvenna or any other kind of oil, you have a sesame oil base or a coconut oil base. Right? Thailam is sesame oil, keram is coconut oil. Then mukkute is where you have more than one kind of oil. It could be 3 oils, or it could be 2 oils and animal fat. Right? In this specific case, it was 3 oils. Then Shavam Nadatti means it will walk the dead. So the name of the oil actually means it will even walk the dead. It will make even people who are dead come back alive. That was the name of the sloka. Shavam in Malayalam means dead body. It will even make the dead body come up alive. I was quite fascinated by this. So I called him up readily and asked him, "What is this thing? Because I've never heard of this. I'm hearing this for the first time in my life. There's no label. It was just a handwritten, manuscript on the top of it. It's just a sticker." So he said, it's actually a combination. It's a traditional medicine. It's a combination of 3 oils, and the base, as you think, is not just 3 oils. The base itself is Mahanarayanam Thailam. So the Mahanarayanam Thailam, which is in Ayurveda, is used as the base oil, and you add medicines into it to prepare something new. Now, the effect of this oil is, for people who have had cardiovascular accidents like stroke, who are paralyzed, if you administer this oil, not externally, internally, it will even make the most paralyzed person come back and walk. Wow. So that's why the name. Right. I was quite fascinated. So I used to make a lot of oils with him. So I called him and I said, I want to learn how to make this oil, right? He said, definitely come over. I cannot teach you, in the sense I cannot just give it to you in writing. Come over and you can learn it with me how to make. So he'll show me how to make it. I said, I'm coming maybe next week. That's what I said. I wanted to go, but definitely I was absorbed in a lot of other things. Sadly, after a month afterward, my guru passed away. So he was never able to, while he wanted to, but he was never able to tell me what was the composition or what it was. So to me, that was one of my biggest disappointment. And I was then, since then, I was thinking I should actually devote a bit more time into learning and documenting more these kind of things, because I'm really concerned about the traditional way of healing system has been going on. See, Ayurveda is not about what you, or not confined to what you learn in Ashtanga Hridayam, Charaka Samhita, or Susra Samhita. They are just prefaces. Even if you look at Charaka Samhita, at the end, Charaka himself says, Udaharana matram tu buddhimadam. Whatever I have written is just a preface. Whatever I have written is an example for somebody who has intelligence, right? You need to apply the science according to the conditions and refine it from time to time and apply it accordingly. And that's what we have been doing, or our previous generations have been doing. They actually refine the science. They make new and new formulations. They find new applications to actually do this. For example, Atapadana Yantram. I don't know whether you've heard about Atapadana Yantram. It's an upside down kin, right? In Ayurveda, if you look at Rasatarankani, they usually say that it has to be done just using earth mud pots. But in Kerala, we also apply a paste of betel leaves into it so that it can absorb mercury, which is kind of an innovation that we have did. So there are a lot of these kind of innovations, improvements over medicines, improvements over the theories of Ayurveda, which I think we are failing to document, which we are missing out, right? And none of us are actually putting out enough time to document all of these things, to archive these things. Also goes for the history of Ayurveda, right? So the documentation of the history of Ayurveda is so less, or whatever we have is quite rudimentary and at the best untrustworthy, that we are not able to understand the perspective in which these were written. So, for example, if you look at Ayurveda, most of the people say to me, I think it's a bit misogynistic because most of the places women has been considered as a dravya, right? How and why? So, because at the time when Ayurveda was written, women was considered as an epitome of desires, which is a sum of all the desires that you can have. Okay, which is quite another way of looking at it. So the social, historical, political setup in which Ayurveda was written is as important as the science itself, because it can help us to understand how this could be applied today, okay, to the modern world. So I wanted to devote some time to that.
I think that's what I really appreciate, I think, about you and the way you teach, and your perspective is like really taking a view of, there are all the Ayurveda was written at a different point in time, and we live in a different point in time today. And how do you kind of make sense of those two things? Like, how do you bring them together? And I think you really, that perspective comes out in when you teach and when you talk about Ayurveda. So for me, I find that very fascinating, actually. So thank you for doing that.
Yeah, to sum it up the way I see it, so at the core, there are a set of principles, right? And from this principle, there is a level of application. There is a way it is applied. And what you read as Ashtanga Hridayam, Susra Samhita, or Charaka Samhita is the principle plus the applications. For example, you read aphorisms on the Ashtanga Hridayam Sutra Sthanam. When you go to Chikitsa Sthanam, you read the application of it. So you read Anulomanam as a treatment in Chikitsa Sthanam. You read a peya or a porridge made of Haritaki as a practice of Anulomanam. Maybe Haritaki was available plenty at that time. Should we use the same thing today, or do we have any alternative? Should people in the US be still using Haritaki? Maybe they have their own indigenous medicine which would work better. So these are things which we need to think. So that application level has to be redefined, is my perspective.
Right. And I guess also related to this point of like modern versus ancient, right? Like, how do you address the sort of concern that, Ayurveda maybe, like, for a lot of people, it's a very different, approach to living life, right? Become vegetarian, don't have alcohol, sleep early, right? Like all of these things, like how do you address that concern that Ayurveda sort of limits how I can live my life today in this modern world when I need to be on the smartphone all day, my job needs me to be on Zoom calls all day long, right? So how do you address that?
So the policy that I follow in these kind of cases is to be bluntly honest. Why I say it, because, for example, about you said about alcohol, right? Just because you said it, and just deliberating on it. Ayurveda never said don't drink alcohol. It said drink alcohol in moderation. In fact, you'll be amazed at the poetic expressions that Vakpada has used in the Madatya Nidana. So Vakpada has put out this question to all of us. He's asking, if I remember the sloka right, this is how it goes. He says, if you are somebody who is coming from work after coming home after work and having, if you can't have a glass of alcohol, which is shared with your partner or with your wife, and that sloka, how are you going to face this difficult world? That's what Vakpada is asking you. Okay, so if you read the Madatya Nidana, if you're somebody who doesn't drink alcohol, I assure you, you'll be tempted to drink alcohol. The same Vakpada, the next chapter says about the diseases which will be generated because of alcohol abuse and how to take care of it. So if you look at it from that perspective, Ayurveda never said don't drink alcohol. It never asked you to be vegetarian. There are n number of mamsa products, meat products described in Ayurveda, both in healing and in wellness. And those lot of these kind of things are mentioned in Ayurveda. So the version that Ayurveda is vegetarian or it stands against alcohol is a version which are made by a very few group of people. And that is not actually Ayurveda. That has nothing to do with Ayurveda. That has to do with more like a Puritan hegemony than being Ayurvedic about it. Ayurveda has no such things. Ayurveda is not something sanctions you. It is not something, it's not a set of sermons. It actually tells you to be logical and to indulge in all the worldly pleasures with some kind of golden mean in your mind. You need to have the right amount. You need to understand when, why, and how you are actually indulging in all these things. So to me, I have not found yet to find a challenge where I have to apply Ayurveda to a modern life. So for people who have to drink, I'm perfectly happy if you drink in a moderation, if you want to drink in a little bit amount, as long as it is not going to cause you any illnesses. It's not going to cause you any diseases in your mind and body. And if you want to eat non-veg, I have no issues. As long as you are aware, if you are able to digest that, and a certain kind of meat can actually cause certain kind of risk in your life. If you're aware of this and if you're ready to counteract against it as and when the time comes and do it logically, then I don't think it's a problem. So to me, it is something which can actually blend with the modern day. So to answer your question, yes, again, being bluntly honest, that's the way you do it. and if you just align with Ayurveda, you can see that Ayurveda allows all of these things. You can find references about anything you want. All these controversial issues, including people don't talk about alcohol. I know that people don't talk about sex. People don't talk about these kind of modern nuances, which they are quite, how do you put, there's a stigma around it. But as I said, if you align with Ayurveda, Ayurveda talks about all of these things, and that too very openly and very logically.
Right. Makes sense. Yeah, thank you. Let's take some more questions. Dr. Nami, did you have a question? I think you had your hand raised.
Hello.
Hey, Dr. Nami.
Hello, Nami. Hi.
Hi, Dr. Karthik. So wonderful to see you here and listen to you.
Long time no see. How are you?
Long time. I'm ready for our other conversations, but I wanted to ask you one question for the group. Please. So, my mind has been very involved with India right now, especially since April end.
Okay.
And, you have this very unique position where you have taught students in the US, and you also know a lot about India. You know everything about India and practice of Ayurveda in India. And I was just wondering as to what your thoughts are about how India can learn about Ayurveda and health from the West. Do you have any thoughts about that?
Oh, definitely. I wish that, and basically this goes for the policymakers. if they were much open towards considering Ayurveda, the way in which the American society actually accepts and Ayurveda goes on. Even if I say that, it's quite saddening in the sense that, as you know, we are going through the second phase of the COVID, and it's quite bad. While I know personally that Ayurveda is contributing so much towards healing COVID. The actual reason why I'm in Kerala right now is because my mother had COVID last week, and I had to come to treat her, right? And she's out of COVID now. But again, COVID, Ayurveda has proven very good again and again in these kind of crises, and yet we are yet to explore the full potential of Ayurveda, to accept it as a mainstream. It is so saddening in a place even where in India, that Ayurveda is often sidelined. The policymakers doesn't allow the budgets which Ayurveda should have. The only reason I would say that Ayurveda is still mainstream in India, it's just because of the political social background that people of India have with Ayurveda, or the relationship that we have with Ayurveda. But I don't think that has been translated into the systems wise, in the sense, for example, in my village, if anybody had a disease, we used to have a Vaidya who will actually treat people, and nobody would go outside the village before consulting this Vaidya. So everybody, as and when they have an illness, used to get a very prompt healthcare. And right now, that system has been lost in the time, and none of the policymakers have tried to bring it back. Now, the place I am from, the government of Kerala has been trying to do this. They're actually doing a primary dispensary at every village across Kerala. While this is great, and this is only for Kerala, the whole of India is yet to adopt these kind of systems and utilize Ayurveda. In that sense, I would say Ayurveda is underutilized because of the lack of budget, because of the lack of encouragement from the policymakers. How can we do this? I think awareness is one, but awareness itself is not enough to make policymakers understand it. Researchers are actually a great tool. So I know NAMI is kind of in the forefront in correlating Ayurveda with modern science and doing research on it. I have read many of her articles as well. So the problem is much of this, while being done in US, doesn't percolate to the Indian political system, nor there are people who understand that, which actually leads to a want of a better understanding of Ayurveda in terms of scientificity. Because even if you go to a modern medicine doctor, there are very less researchers available which will make him or her convinced about the proficiency of Ayurveda. So that's actually a sad state, which I hope maybe we can remedy. Maybe you can remedy as well.
Wonderful.
Thank you for answering that, and I'll take you offline on that.
Sure, man.
Great. We still have a few more minutes. So one of the things I love to ask, in this series is about mentorship, right? So a lot of our practitioners are, taking online courses and don't necessarily have enough clinical exposure, haven't really, had a chance to get exposure to rogis and really being in that environment as much as where in a traditional medical school you would have a lot of that exposure. So, the transition tends to be hard from being a student to actually practicing out in the real world. So is this something that you actively provide to students and it could take many forms, whether one-on-one or group mentorship or, courses, like how do you think about mentoring students, Dr. Karthik?
So I have two things which I do in this regard. One, I have been doing mentorship for a very long time. So I have a lot of students who actually study with me, who learn with me. And we tend to explore more and more clinical cases, or they bring clinical cases to me. It's kind of a hand-holding. For example, at the beginning, when you start treating illnesses, you might hit a lot of roadblocks. So you might need a bit of a help there to actually clear up the idea and go in the right way. Yes, so I do provide mentorship on one-on-one basis. So that is something which I do. And over the time, over this last few years, I understood what are the main problems of students who are going through it. So that's why my newest program is something what I call as Advanced Ayurveda Clinical Program, where I address about the most commonly asked questions. For example, what is Avaranam? How do you understand Avaranam? Well, how do you go about the Shroto Dushti? How do you treat a Pandu? How do you see a PCOS? So these are 10 classes on 10 weekends. And so that's where we explore as a team on all these topics and create a better understanding. And we have a support group which will help people to understand more on each of this topic deeply. And plus this, I also have a mentorship which I give on one-on-one basis, where they can actually contact with me and arrange a one-on-one consultation with them at any point of the time, and we can talk about the case or the doubt or anything about Ayurveda what they have. Yeah, I do.
Very nice. And what is a good way for people to, I guess, reach out to you, whether they want to do consultations or whether they want to do mentorship? What's a good way to contact you?
So either they can, I'm in the group anyway. So
yeah,
you have my contact.
We added you to the group. We actually also want to add you to the Chikitsa group, where we discuss specific cases that practitioners are working on.
So you can either reach out to me through my WhatsApp, or my email ID is Dr. Karthik, my name itself, Dr. Karthik Krishnan @gmail.com. There is a Dr. DR in front of it. That's it. Dr. Karthik Krishnan @gmail.com. So that's another way to reach me. Yeah. Or you can go to my website. It's called organicayurveda.com.
Great. I'm just typing this here in the chat so everybody has it.
Sure.
All right. And I guess since we just have a few more minutes left, other than Ashtanga Ayurveda, which clearly you're very, very passionate about and carry with you everywhere, are there any other books that you're reading at the moment, or recently read and would highly recommend? Could be related to Ayurveda or broadly health or anything else?
So I read, other than Ashtanga Hridayam, I read this book called Chikitsa Manjari, which is actually a Kerala book, a book from a Kerala tradition. Unfortunately, it is written in Malayalam, and I am not aware of any English translation out of it. Other than that, I usually read poems. I don't think outside medicine, I read mostly like poems. Gibran and Rumi are my favorites.
Mm-hmm.
So I read most of that.
Very nice.
Yeah. So the latest book I've been reading is by Elif Shafak. It's called The 40 Rules of Love. It's about the relationship between Rumi and Shams of Tabriz. So that's the book I've been reading. It's a great book.
Wonderful. There's a question about asking you, do you offer consultations?
Yes, I do.
The answer is yes.
Yes, definitely. That's yes. That's my trade. Yeah, I do.
So what's the name of the last book on Rumi that you mentioned?
I'll type it in here. It's called, I will try to type it. This is the book.
Very nice. All right. And I guess, so, as Ayurveda is an ocean and all of us are learning, what is something that you're trying to learn about right now?
I am trying to learn more about the local tradition of Ayurveda, how the history of Ayurveda was forged, and how the system, because it gives you a lot of insights about the application as well. Because before any Portuguese ship sailed the horizons of the Indian Ocean, Ayurveda was the only system which was healing people of all of the South Indian continents, right? And it was a fully fledged system. Much of it has been lost. Many practices are being lost. Many textbooks have been lost. I'm trying to understand more and more about this and the origin from which all this started. For example, it actually goes back to the culture of many South Indian tribes. I don't know whether you've heard about Siddha medicine, which is another form of medicine, which is closely related to Ayurveda. It is Vata, Pitta, Kapha in it. So my guru was actually a Siddha from a Siddha tradition. So I learned a bit about Siddha as well. I'm trying to read more on it because it's quite a kind of a Dravidian medicine, and it is written in Tamil, which is one of the oldest language. If you look at India, there is a quite controversy about which emerged first, Ayurveda or Siddha. I personally believe that it was Siddha because it's an older language and the principles are much more older. In all probability, Ayurveda was codified out of Siddha. So Siddha is not as documented well as Ayurveda. So I'm trying to study more about it so that we can find more and more applications. For example, Ayurveda in South Indian tradition doesn't have much of herbal mineral combinations, whereas Siddha have great herbal mineral combination.
Is the
and-
diagnostic system pretty similar in Siddha?
Oh,
and
it is
Ayurveda?
very similar. Very similar. Yes.
Okay. Got it. So where is the main difference between the two? I guess as you're mentioning, there's the herbo mineral aspect, but are there also other differences?
One is the language in which it is written, right? It is written in Tamil. The second thing is they extensively uses herbal, herbo-mineral, and mineral oil compositions. Siddha was originally, how do you put it? Originally conceived as alchemy. The aim was to actually to remove sadness out of this world, and alchemy was, of course, to get the moksha, to get nirvana. That was the original aim. So I would say the philosophies are much more oriented. Even though Ayurveda actually found out for the same reason, I think over time we have definitely diluted a bit. So yeah, it's more close towards the core, and Ayurveda has a lot of roots in it. So I'd like to explore that a bit more. So I'm trying to learn more of history right now.
Right. Very nice. Are you looking for students who can help you with research? Because I'm sure there'll be some takers here who would love to work with you.
Oh yes, maybe in the future. I'm just reading it. I need to read a lot more. I need to work a lot more into it.
Very nice. All right. We are almost out of time. So it's exactly 10 a.m. PT here. Thank you so much, Dr. Karthik, for being here today. This was an amazing session. And thank you to everyone who joined today and for being here and participating. Lovely to see you all again today, and very grateful that we have this wonderful community that can come together. Thank you. Just in terms of some brief announcements, we will continue to have our regular community hours on the last Friday of the month. We have book club coming up soon next month. And I don't know if Shagun is still here and wants to share what we're going to be reading next month. Shagun, are you here? She may have dropped. All right. But if you're interested in the book club, just ask in the group and we'll add you guys. So thank you again for joining everyone, and have a great Friday. Have a great weekend. Thank you.
Thank you, Shruti.